Do you have uncontrollable movements such as shaking, stiffness, difficulty with balance and coordination? Are you moving too slow or observed change in speech or handwriting? Then you are at a very initial stage of Parkinson. Parkinson disease is the second most common neurodegenerative disorder in adults over the age of 60 years. India has more than 500,000 people living with the Parkinson disease. Scientists across the world are collecting genetic and phenotypic data to develop a solution for it. Till they find it, we need to fight this disease. So here I am explaining you in detail about the Parkinson and what you need to do if you have it. But before I do that, if you have not subscribed my channel, please do it now. Parkinson is a neurological disorder. There is no specific cause for Parkinson. However, nerve cell damage in the brain leads to drop of the dopamine level, and as it starts decreasing, your day-to-day movements gets affected. Are you confused? Let me explain you in a common term. Dopamine level acts as the connector between the nerves. Signal from one nerve should pass to others smoothly for us to do the active movement. If dopamine level drops, nerve may not transmit signal which carries the millions of nerves and muscle cells required for the movement accurately. In 80% of Parkinson case, there has been decrease in dopamine level. It means dopamine level is the main reason for Parkinson, but not the only reason. Parkinson conditions can affect your thinking capability, like not remembering, no relative reasoning. It also affects your chewing, eating, and swallowing problem. You may also start facing sleep disorders or bladder problem. The Parkinson usually begins in midlife or after the age of 60. It's very rare for young person to have Parkinson's. If you have the symptoms at a very young age, that you need to definitely go for a genetic counseling. You need to understand this. It's not as serious as you think. Yes, there isn't any cure for Parkinson's, but the right kind of guidelines and medications can improve your conditions. Like I said, this disease doesn't have any cure, and it mostly begins after the age 60. So medication starts from home. People having Parkinson's should be given more care and affection with lots of patience and education. Home needs to be set up or designed in such a way that the person doesn't fall due to imbalance. While there is medications to increase the dopamine level, physiotherapy plays an important part to make the daily life simpler and make them independent. Parkinson's specific exercise can reduce the symptoms and help the person regain the strength, endurance, and flexibility and balance. A physiotherapist can work with you to relieve muscle stiffness and the joint pain through movement and exercises. There are various programs and training like fall prevention training and gait training which you can consult to a doctor. This training will help the person to do all the daily activities independently. We at Physio 365 have strategically designed these programs which are helping our patients to do their daily activities independently and confidently.